Hey there, it's Dr. Jim Collins. Welcome to another episode. Got my David Bowie mug, and I want to do a little experiment before we get started. It's true, everything does taste better in a David Bowie mug. Thank you, David. And speaking of taste and tasting better, this episode is on helping older adults with appetite loss. And I have another video where I address some of the problems with a decreased appetite among seniors. This one I go into it a little deeper though. And this is a common problem. Unfortunately, loss of appetite and many of the associated negative outcomes with this loss of appetite is a very common problem for many adults. As a matter of fact, the National Institutes for Health estimate that between 10 and 30% of older adults have a decreased appetite. And when you look at the baby boom population in the United States, that's millions of seniors, millions of older adults. So this is not a small or minor problem. And there are numerous reasons for decreased appetite later in life. For instance, the side effect of certain medications, I talked about that in my last video. Decreased energy, we just don't burn calories like we used to unless we are very, very active. And various physical health conditions, psychological and emotional disorders, and the neurodegenerative disorders like Alzheimer's and Parkinson's, Huntington's, ALS, multiple sclerosis. All of these types of disorders of the neurodegenerative kind can greatly interfere with someone's appetite and eating. So, I experienced loss of appetite with my mom, who lived in a skilled nursing facility for the last few years of her life. And I noticed that as her appetite declined, I mean, she was 100% Italian, and the woman really liked to eat. So, as she aged and she became more confused and memory impaired and physically impaired, her appetite just really diminished. And I was sitting with her during meal times and encouraging her to eat. She would take a couple bites and she would say, "That's it, I'm done." So, as her appetite diminished, though, I also saw her quality of living and her well being diminish. And that's something that I'm concerned about for a lot of seniors because food is wonderful. I'm a foodie, you might be a foodie, and I love wine and food. And as I age, it's not so much about eat, 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 drink, drink, drink. The quantity, it's the quality and slowing down and enjoying, the flavors and savoring what's happening, the entire experience. So there are simple ways to improve a senior's appetite. Everyone has their favorite foods. I do, and you do. We also have our favorite beverages. When seniors start pushing that plate to the side and become less interested in eating, we need to take note of the types of food that they are rejecting. If they don't want to eat something, at their age, I don't think we really need to push them to eat it. How about replacing what they don't like with what they really would enjoy? Give you a good example. My mom didn't like the food at the skilled facility all the time. And this is a common complaint of many seniors who live in senior care facilities. It's nothing new and it's very common. So what I started doing was I would bring in Taco Bell and Dairy Queen and McDonald's and Kentucky Fried Chicken, and I would bring in pasta and meatballs and Italian sausage and things like that. And guess what? She ate. She really, really ate. So my mother began eating less and less from the tray, and I would say, "Come on, Mom, you got to eat more." And Mom just didn't eat more. So after I brought her favorite foods in morning, oh, donuts in the morning, Mom ate those. Milkshakes, chili dogs, I mean, French fries. She just loved so many things. So I would bring it into her, and she would say, "Oh, I'm not hungry, Jimmy." And I'd put the hot dogs and french fries or onion rings and milkshake in front of her. I'd turn around for a minute. Gone. She ate that fast. So giving her what she wanted was the key. Now, I know on a large scale that can get tricky, but if you believe in person-centered dining, as I do, then there should be many options and many choices. And those choices should be meaningful choices. In other words, they are things that the senior would definitely want to eat. Now, since my mother had some type of dementia, it's important to talk about the disease progress as it progresses. It became more and more difficult for her to eat full traditional meals. So what did we do? Started cutting things up into bite size. After she couldn't use a knife and fork anymore or a traditional plate, so what? She ate with her fingers. She ate with her hands. We went to simple foods, finger foods, and cut larger foods into smaller bite-sized pieces. And she ate more because it was almost like a snacking thing that she was doing. So another way to improve diet is give seniors who are maybe memory impaired bite-sized food. And you might be surprised at how much she ate, at how much they will eat. Now, she also had dentures. So dense foods, out of the question. Chewy, tougher, crunchy foods, not so much. Softer foods, but that had some texture. You could take food and make it so soft that seniors just absolutely lose their appetite. And nobody wants that. But things like french fries, grapes, pudding, popcorn, chips, broccoli, beans, little slider sandwiches, little hot dogs, things like that. It just was easier and more enjoyable. She liked it. I loved the fact that I saw her eat and I knew that she was getting some caloric intake and she wasn't dwindling away. So the other alternative is malnutrition, and nobody wants that. So thank you. I think I've said enough for this episode on helping older adults with appetite loss. My name is Dr. Jim Collins. Take care. I'll see you soon.